there were 10,000 up for grabs and lines of cars waiting well before the clinic opened at 10 o'clock. Within an hour, staff at the site had copped abuse.
Well, look, being aggressive to the hard-working public health staff isn't going to advance your spot in the queue any further or indeed help anyone's.
The system wasn't without fault though. Some Canberrans were turned away, mistakenly told the clinic had run out.
They've turned away my husband and son even before 10 a.m, claiming they've exhausted the allocation. What an absolute joke.
We were advised at 9:45 a.m. by a traffic controller that there were no more tests available.
What an absolute joke of a process. Just lined up and waited in line for 25 minutes to be moved on.
The problem, in fact, was traffic, not supply. And by early afternoon, the chaos had cleared.
Today was the first time that 10,000 rapid antigen tests were being made available. Things will improve. Lessons will be learnt from the experience today.
And they'll have to. The Territory will receive 75,000 rapid antigen tests next week and 1 million the fortnight after. They'll be divided among testing sites and the health workforce.
That will reduce the waiting time for people to get a test, and it will reduce the waiting time to get a result.
1,125 new cases of COVID-19 were recorded in the ACT in the last 24 hours. Today marking the first time rapid results were included in the figures. 27 people are in hospital with the virus, 3 are in intensive care, all requiring ventilation.
And they're mostly unvaccinated people. Over the whole course of this pandemic, it's been unvaccinated people who've needed the most health care.
Like many bosses running an essential business, childcare operator Torian Lau is facing critical staff shortages.
As of this afternoon, I have 40% of direct staff actually not at work, in isolation.
National Cabinet yesterday agreed on new isolation rules to help employers like Mr Lau. They will mean essential workers who are close contacts but aren't sick and test negative to COVID-19 can return to work. Mr Lau says it's a good idea in theory, but not in practice, when Canberra's testing centres are struggling to keep up, and finding a rapid antigen test is like finding a needle in a haystack.
It's all good and well to try and get people back into the workforce or keep them into the workforce, but without providing the resources, they're pretty hollow words at this point in time.
With more than 1 million of these destined for the capital, there's some hope it won't always be this way. Rosie King, ABC News, Canberra.